Hello, it's Jared Ingham here, GP and Director of Springs Medical, providing another update on what's happening with COVID-19. Thought it was important to find out what was happening down at the Daylesford Pharmacy, so I brought along, or asked to come along, Rachel O'Connor. Hello,
Thanks,
Rachel.
Jared. Thanks for inviting me along.
Yeah, so can you give us an update on what's happening down at the pharmacy?
Okay, well we have sort of significantly changed the way we're doing things at the moment. We are asking people to ring ahead and order their prescriptions. Many people already keep their prescriptions on file, so rather than coming into the pharmacy.
So the also where you come in, you drop your prescription off
Yeah.
and then go away and come back again.
Yeah.
You're trying to just
We're just
one
trying
visit.
to minimise the contact.
And you don't want people sitting around in the pharmacy waiting for that to be filled?
No, we're asking if people can, if possible, wait outside of the pharmacy.
Okay.
We're also restricting the number of people in the pharmacy at any one time, again, just to allow us to all keep that safe distance.
Yes.
Safe for you guys and safe for my staff,
Yes.
which is really important.
Okay, so a person would ring ahead about the prescription to see that it was available and ready. So I'm just going to take you through two different scenarios. So one, where the patient has a prescription and you don't have it and they need to bring it in, how do you want them to do that?
Then in that case they will still need to bring it in. It is a good idea to ring ahead just to let us know that you're coming down. Many people do use our MedAdvisor app.
Okay.
So you can actually do a snap and send. That way we can have most of the paperwork done before you get there.
Okay.
If you don't and you just have it with you, just give us a ring just so we can make sure
You've got it in stock.
we have it in stock.
Yeah.
There have been a few things that have been unavailable of recent times.
Just hold off and talk about that for a second. So that's with that. But if in the other circumstance where you either have the prescription on file, or more and more what's happening now, of course, the patient's had a telephone consultation with the doctor, and we've said we'll send the prescription down to you, which is great the way you're accepting in that way. So we send the prescriptions down to you, but of course they often take 24, 48 hours to get down to you.
That's correct. Sometimes it does take that length of time.
For example, the day I've been consulting from home, and so I only bring up the prescriptions to the pharmacy, usually we bring up tomorrow, the next day, and so then it has to go down to you. So there'll be 24, 48 hours before they get down to you. So in a circumstance where you already have the prescriptions or Springs Medical sending the prescriptions down to you, you want the patients to...
If you could ring and order what you're requiring, ring and make sure we actually have the prescription.
Yes.
If it's been a day or two and it hasn't turned up, we are very happy to chase that up with Springs Medical for you, rather than you having to make phone calls yourselves.
And so that way when the person comes in, they can...
It's basically ready to go.
Yeah. And because that's what we're all trying to do, is to reduce contact with each other.
That's exactly right. Not that we don't like seeing you all, but at the moment we need to keep...
We don't like to see you that much at the moment.
That's correct,
So
if it is a new medication or you feel you want to have a chat with a pharmacist, absolutely we are available to do that over the phone.
Okay. And I was hearing you saying that there might be circumstances where a person felt very anxious about coming into the pharmacy and you might even deliver it out to their car.
Yeah, so if you are in one of the vulnerable groups, so the elderly, or you're in isolation and you don't have anyone else who can potentially come down and pick it up for you, we will be putting in place a delivery service.
Okay.
There's also the option if you are able to come down but you don't feel comfortable about coming into the pharmacy, or you're unwell, or again, one of these vulnerable people, then we can bring things to your car. So we would ask that you ring to place your order. We'll let you know when it's ready.
And
then if you can, again, it seems like we're doing a lot of phoning at the moment, but if you let us know when you're there, we can bring it to your car. We can bring our EPOS machine out to your car. It's also possible that you can pay over the phone.
I heard you say that you were a bit distressed to see quite a number of elderly people, at-risk people coming into the pharmacy.
Yeah, I'm still seeing a lot of our more elderly population out and about, which we would rather not be seeing any of you at all at the moment. So I guess if you have a neighbour or a family member who can do your shopping for you, and it doesn't just include pharmacy shopping, this is also grocery shopping, anything that takes you out of your home.
That's the safest thing.
That's the safest thing to do. If you don't have anyone to help you, then by all means, just let us know and we will organise something to get you your medication.
And you were saying before, Rachel, about some medicines being in short supply.
Okay, so there are some medicines in short supply at the moment. It's not a case of them not being available due to a manufacturing issue. It's more a case that
everyone's stockpiling.
Everyone's trying to stockpile.
Toilet paper issue.
Yeah, so basically that's exactly what's happened.
Yes.
They're just having some logistical issues replenishing stock, so orders have been delayed at the moment. We can order some things and not get them for 2 days.
But so it's a bit like in Italy, where they've said the things that didn't stop, the supermarkets are still open and
That's
the
right.
pharmacies are still open. There's still medication to be. So
That's
people
absolutely
stockpiling
correct.
these things, thinking that they will not be available during a lockdown,
Is actually going to create an issue. So the pharmacy is not closing. We will not be closing. We are open.
come on.
Come what may. So we have been directed by the health department to not allow stockpiling.
Yes.
Which means you can have 1 month supply at a time.
Yes.
So if you are coming in and you've only had your prescription filled, say, a fortnight ago, unfortunately we're not going to be able to fill your prescription. There are some medications, particularly Ventolin, that is in very short supply at the moment. So they have changed the regulations around how we can supply and when we can supply and who we can supply. So we are just trying to reserve the supply for people who have a genuine need.
Yes.
So at the moment we're only allowed to supply if you have a prescription, and that's only 1 inhaler at a time. So you need to have a diagnosed lung condition, is the long and the short of it.
I think one of the messages coming out of the pandemic is we actually just need to be caring for each other.
Absolutely.
We've got to the prescription that you fill or stockpile with Ventolin, which someone else who has a genuine need later.
Yeah, that might mean they can't access it.
It would be a terrible act.
And it is a life-saving medication.
Absolutely, it is. Yeah. So, but hopefully you're also seeing people being very nice to each other down there.
Oh, we are. Most people have been very understanding.
Great.
They have.
Your staff must be really under the pump down there.
They are really under the pump at the moment. They're working really hard.
Yeah, and I know you've been telling me you've been working enormous hours as well.
Yeah, we've been. We've basically done in the last week and a half what we might normally do in 3 weeks. So we're just trying to make it happen and also come to grips with this new way of life for everyone.
Yeah. So I'd probably just ask again. It's been an underlying message of our videos is that everyone just be kind to each other and care for each other during this time. I think that's very important.
Yeah, if we can all look after each other, then we'll
get through it.
Absolutely.
Absolutely. Good on you. Thanks, Rach.
Thanks, Jared.